Hello, and welcome to a special COVID-19 edition of the What Works for Children's Social Care podcast. Government guidelines around social distancing have forced us all to change how we live and work, not least those working with some of our most vulnerable children and young people. From our conversations with social workers and children's services departments across the country, we know that many have responded with imaginative and innovative solutions to the challenge posed by COVID-19. These podcasts will share with you some of the ways people working in children's social care are responding to inspire and reassure you. If you have a topic you'd like us to cover, or you would like to get more involved and share how you're adapting with these challenges, please get in touch. Details are in the show notes. Hello, I'm Michael Sanders, Chief Executive of What Works for Children's Social Care. We're an independent charity looking to create and collate an evidence base in children's social care to improve outcomes for children, young people, and families. In the latest edition of our special COVID-19 series of podcasts, I'm talking to Julia Hassall, the Assistant Director for Children's Social Care in Rochdale. Prior to taking on this role, Julia has worked as a project manager for No Wrong Door and leading practice improvement. Julia has an extensive track record of working in children's services as a manager and leader in the north of England. Julia, thanks for joining me today.
Hello, thank you.
So can you tell me, during the pandemic, how have you adapted your previous practices to meet the really radical change in the way that we have to do everything?
Okay, I'm just trying to think back to week one after lockdown, that night after lockdown, and lots of conversations with my senior managers and director. We all felt like we're in a film like Apocalypse Now or something. I think what has guided us through is that we have a relational practice model in Rochdale. So we have a partnership relationship manifesto, and beneath that, we have relational practice as our practice model. So I think that very principled approach has guided us through uncharted territory. And we've tried to take the approach of standing in the child's shoes when we've been doing assessments of vulnerability and how to work in this setting. So one of the things we did very quickly was get guidance out to staff. 3 core pieces of guidance. One was about working from home, because I think we've had, like a lot of children's services and social care in particular, people are usually in the office and work from the office. And that's been the conventional wisdom, that to manage risk safely, you work together in teams, particularly social workers. So the working from home, there was guidance around how you prioritised your work, emphasising you were still accountable for your caseload. We want how we work to help people adhere to relational practice principles and keeping recording well, how to create space that was safe in your environment. And we gave out guidance in respect of home visits and undertaking contact with children and families, or family time as we call it. And with home visits and family time, we were really clear that if we needed to go out to assess risk, we would go out to assess risk, but do it safely, with social distancing, using PPE where necessary. And the vast majority of family time was virtual, but we never say never. So if a child needed to have contact with a parent, that would happen, and we'd work out how to do it. We stepped up our level of communication, so very high level of communication. The director from the outset did a daily briefing, which was really important. It would include humorous things, such as what to do if your child kept moving in and out as you were trying to do a Skype call, people dressing up on team meetings, how to address emotional well-being, news about what was happening locally in Rochdale, how we were setting up the resilience hubs. But that daily briefing has been so critical and continues to this day. And the director has just been as led from the front. And I think that level of leadership from the front has just been the thing that's given a safe space and helped people feel they're in an organisation that cares about them as practitioners, and it's enabled them to care for the children and carry on being creative. In the organisation, we've had obviously Gold Command meetings, and as a children's social care service, we've had a COVID meetings with the director twice weekly to start with, then once a week now. I started off with daily meetings with my managers, and they were saying things like, It's really hard because people are asking me questions and I don't know the answer, but we were checking them out with each other and it was saying, well, that's okay. Dig deep. What does your intuition, what does your wisdom you've developed over years tell you might is the right way forward? We started off with gathering a lot of information. So, right from the off, we wanted to understand what was going on in terms of referrals coming into what we call EHASH, which is our Early Help and Safeguarding Hub. So, the number of referrals, but who they were coming in from as well, which disciplines, because we had very, very low referrals that first week. So just knowing what was going on was really important, and then swapping notes on a northwest basis. So the director was part of a northwest DCS meeting. We also risk assessed every vulnerable child. So every child that we were working with had a risk assessment. And we obviously you have to cascade that down to individual practitioners doing that and managers signing them off. So very crude, rag rated, but in terms of understanding which are the children we need to really keep our eyes on if they're not in school, but our schools work very closely hand in glove with children's social care, so they shared information. So we adapt the previous practice we adapted, we amplified and turned up our relational practice, our communication. If in doubt, consult was our principle, creating opportunity for people who might feel isolated and scared at home to keep in touch with their managers. So people were saying there's a lot less emailing and a lot more talking.
Yeah, it's nice to have that. You mentioned people dressing up for team meetings. I sort of have in mind people that dressed up in superhero costumes or something. Is that the kind of thing, or people just?
Yes, there's all sorts of things. We've even had something today with our personal advisors dressing up with headsets with flowers on because it was Ladies' Day at Ascot yesterday. At Aintree. Oh, sorry, it's Aintree, isn't it? I'll get shot. That's Liverpool in the northwest.
And so, what sort of new initiatives have you been able to put in place over the course of the pandemic?
I think, like everyone, we've been using virtual communication means, and at first it was we were kind of struggling a bit, like all authorities, to know which platform to work on so we could engage partners, and we've got much more conversant with that as we've gone along. I think engaging with children who are cared for virtually by Skype, sometimes they were saying we feel much more comfortable talking with our families, perhaps with our social workers by Skype. Parents were saying it's actually really good that we can see our children's bedrooms in foster care. Children who lived a long way away, live a long way away from Rochdale, would often keep in touch by phone in between visits to them. And what we've done now is we've been engaging with them where they can see us. And that means so much more. That's been really helpful. We do a lot of training in Rochdale in relational practice with a partner organisation, strengthening practice, and so we've carried on with the training which has been delivered virtually, which feels really important if we're saying relational practice is the bedrock of how we'll operate. But one of the trainers, we've actually engaged in coaching sessions with him. So he's done individual coaching sessions with members of staff that they can book into. And then that's developed into a coaching session with a manager, followed by a coaching session with the manager and their team. And that's been really helpful in sustaining people and just keeping people's resilience. What we've done with initial child protection conferences has been interesting. And I'm asking that we do conversational audits with parents who've attended just to really understand what it felt like. So in our headquarters, we've continued to say that if we're doing an initial child protection conference, it's a basic human right as a parent to be part of that conference. So right from day one, we've invited parents in to sit with the chair of the conference miles apart in a room with a secretary, and the partners have Skyped in. So that clearly must change the dynamic, and I would hope that feels better in some instances for that parent. I think some of the ways in which people have engaged, our social workers, our residential workers, our contact or family time workers, have been truly exceptional. And I'd like to think give the high level of support we've given to people has enabled that creativity to blossom and flourish. So, for example, parents have taped lullabies that have been played to their babies in foster care. Foster carers have kept video diaries of a baby starting to eat solid food or first steps. There have been a 3-year-old wanted a weekly disco with her mum, so that was done. Children have given virtual tours of the houses that they're in. A social worker said to a child who was speaking to her on her phone, FaceTime, spin round like a ballerina, just to check she was talking to that child on her own. I've seen a social worker who's laminated cards and gone out to do direct work with children through the window. We had children in a really distressing situation, and I sat down as the AD with the manager, and we did a risk assessment because the social worker needed to go out, and we worked out how to safely manage that meeting between the children and the social worker. So lots of creative ways of doing things. I think just three more quick things I'd say. I think we've been really quite proactive with foster carers. So we've been making calls to foster carers twice weekly to start with. We've worked with a local organisation, and we've delivered creative art packs to children living in foster homes after quite a significant period into lockdown, when a number of foster carers, the majority I think, were choosing for their cared for children to stay within the family home rather than go into school. They were educating them with their own children, often at home. We gave an extra allowance, the allowance that you give during the school summer holidays, in recognition of just what they've been doing. And they've been magnificent, and they've really worked in partnership with us. We've done group work with families in distress, where we've done families where there are programs around parenting. And sometimes what we found using Zoom, where we couldn't have parents in a room together with each other, you can have them in the same room, so to speak, in different rooms, but they're together on a screen, and you can use the mute button if things get really difficult. So people feel they've been in a bit more control. So we've done some programs such as Break for Change, where children are being aggressive towards families and families needing to argue better. And so lots of programs have been made virtual. And then we did an initiative before Easter with the police, where they'd acquired an enormous amount of Easter eggs, and they were dropping them off at families that had rainbows in the windows. We took Easter eggs out to households where there were vulnerable children we were struggling to see, and we left Easter eggs on the front doorstep and then stood back and had conversations with families. So lots of creative ways of doing things, but trying to all the time do the right thing. And we've not actually used any of the DFE easements. We've just wanted to stick with what's good practice, how we record, developing ways of recording virtual contact, so that we all the time know what's happening, and we're seeing those vulnerable children.
Yeah, it's one of those few of the things you mentioned are really interesting around perhaps some of the changes in the power dynamic. So initial child protection conferences, and also sort of those conversations where people are in the same room but not in the same room, as it were. So you can mute them, and so very often the people who shout the loudest get the most attention. But you can that can be regulated better and hopefully give people more of a chance to speak for themselves. It's quite interesting, this sort of that shift in the power dynamic.
I think there's been another shift which has been absolutely fascinating that we've been thinking about and commenting on, where families have been asking us, "How are you?" There's been a massive change. Partly, I think, at first because it felt, I don't know, like we're all fighting this together, and it's been a great leveler in that sense. So that's been a shift as well.
I mean, that question of how are you to a social worker is a really important one. So social workers obviously been working at home for a long period of time now. In the most part, this is a job that requires you to deal with quite distressing situations very often, and to do that in an environment where you don't have the day-to-day contact with your colleagues in quite the same way. So they can't see your shoulders slump when you're sort of sat at your desk after a really difficult visit or something. How are you finding the well-being of your colleagues is getting through this, and what are you doing to support them?
I think right from the beginning, we've engaged in tried to engage in a high level of communication and supported that. And I think it's quite fatiguing being on Skype or Zoom all day. So just noticing that and commenting on that and trying to look at how we give space for people, trying to recognize that if you're trying to school children at home, you won't be able to work 9 till, 4:45 without a break or stopping. And so working out that people might start work a little bit earlier and then need a break to do something with the children specifically rather than trying to work and keep them occupied at the same time. So being flexible about working time. As I say, high level of communication. So managers were speaking to every member of staff every day to start off with. Certainly making sure there's a weekly team meeting when the whole team are getting together, just being really clear, giving permission and demonstrating that if you're worried about something, it's really important to speak to somebody, making that normal. People at all levels have been saying, well, I'm stumped. I just really don't know what to do in this situation. So making it all right. It's not where you've got to keep a stiff upper lip all the time, and acknowledging that people are scared. People are dealing with fear about elderly relatives, fear about what will happen to them and their children, fear they might get poorly themselves. So it's just trying to kind of acknowledge that. I think also, whilst we've kind of, for example, worked on rotas and had, one social worker from each team and a manager in every day, we've really tried to be mindful that there are some people who are struggling more than others, perhaps people who live on their own. And where they've wanted to come into work more, we've done our best to accommodate that, because we don't want people to become poorly, and we're just trying to kind of look out for each other if at all possible. We've put quite a lot of emphasis on creating a safe working environment and preparing for people to start coming back to work more and more people to return, though we're not envisaging everyone will be back in the office at all at this point. We're still working on the basis if you can work at home, then do work at home. But for example, setting up one-way systems around the office, putting hand sanitizers in, separating desks. So there's literally red and white tape on every other desk. So you can't really sit next to each other. Each of us noticing if people are getting too close or if anyone's upset. But then in the director's daily briefings, taking photographs of what we've done and sending them out so people can see what measures we're putting in place to make the environment safe and for them to return. I think something else that we've done around well-being is we've tried to think, I think you said it earlier, Michael, if you were in the future and look back, what would you almost think you wished you'd done? And we asked ourselves that question. And the director and the assistant directors then gave an opportunity for frontline staff to speak with the senior leadership team directly. So it's kind of cutting through conventional hierarchies, giving people every opportunity to say how they are and what's helping and what else we could do. A member of our staff has offered mindfulness sessions, 10-minute mindfulness sessions that have been really well taken up, and using opportunity to have fun and do, I think I referred earlier to team meetings and dressing up and things like that. So we've also worked really closely with human resources. So we've been adapting guidance, making sure that there's a whole range of different resources and packages that are available that we, and largely Gail as director has been getting information out on those daily briefings. So lots of high level of communication directly and in email.
And is there anything that you've had which has particularly been challenging over this period? Any particular challenges?
I think people have been really worried about low visibility of some of our more vulnerable children and families. And I think at the beginning, we were really, really worried about perhaps children living with domestic abuse. and how lockdown is an antithesis of being, if you're really scared, you don't want to be locked in and locked down. We heard stories of some of our children on the autistic spectrum creating little dens within the house because they were really scared. But equally, some other children loving it because they didn't have the moving from home and to school and having a more consistent environment. In terms of domestic abuse, we've a really strong domestic abuse coordinator in Rochdale, and she set up a weekly conversation right from the word go, looking at how we reach people, so a whole range of different mechanisms using social media, working through local communities. So there was a community of interest really where partners were engaging in that conversation about how to reach out to our most vulnerable children and families in the community. I talked earlier about the coach from Strengthening Practice doing some sessions with individual managers and group and their teams. And early on, he did a session with the youth justice team. And the police officer in that team said that they'd heard about a young person who said, it's awful. I'm really scared by what's happening at home, but you won't have the time and you won't be bothered because you're too, worried about coronavirus. You've enough on your plate. And I picked that, and so it's picking up from little conversations what you can do. And from that, we developed some gifts that went out on social media. That was a young person with a thought bubble saying, I'm really worried about what's going on at home. And the next one said, I'm really worried about what's going on at home for you. Tell me about it. And just trying to get the word out there. We've had challenges with young people whose family relationships have become very fractured. And lockdown has just tipped it over the edge. Some young people living with grandparents and their own parents have been worried about the safety of their parents and the child's grandparents, so because they've not been socially distancing. And so they've ended up coming into care. And we've engaged with our youth service, just trying to engage these young people and get them back home if at all possible. I talked earlier, I think, about juggling a lot, feeling isolation, having children at home, not seeing relatives. I think IT has presented some challenges. At first, I remember chairing a partnership meeting, and we were on the phone, and some people were on Skype, and some were on the phone, and they were leaving the meeting before I realised who was in it, and it was just confusing. And we've got much better at that. And I think there are some meetings that are really hard to do virtually. So I've done a couple of deep dives in connection with No Wrong Door, and you really need to really see and feel people in that room. We've done a practitioners event in respect of a practice review. And again, when issues are quite emotional and there's difficult subject matter, it's hard to capture that and respond to that quite as well as you'd want to, I think, when it's virtual.
One of the things that you mentioned there, which I've heard as well speaking to others, is people not wanting to get in touch with services or not wanting to be a burden on services. So there must be something more important to be going on at the moment. Whatever it is that I'm struggling with is probably minor compared to a global pandemic. I think that there has been a bit of a struggle to get the word out to people that know services, the police, social workers, everybody, you're all still there, and people should still be reaching out. That sounds like you found that as well up in Rochdale.
We did. And I think, like you say, Michael, I think that's been a national thing, hasn't it? And we've done a video recently linking with the Safeguarding Children Partnership, where we've engaged with local social workers and health staff, getting messages out into local communities saying, if you see something you're worried about, be brave and tell somebody. We've been working with the voluntary community and faith sector on that as well, and just trying to reach the parts that sometimes the statutory organisations don't reach. Been really worried about the massive reduction in children being brought to A&E with physical health problems, because hospitals have become an unsafe place to go to in people's minds. And I can quite understand that with the lockdown message. And I think nationally that's being really promoted, isn't it, now? That if your child is poorly, it's really important you get back into touch.
Yeah, definitely really important that message gets out there. Also quite different from some of the messaging that the government might have been pushing a few years ago. And if your child isn't sick enough to go to A&E, don't go in. Obviously, a lot's changed quite quickly. A lot of that's been very challenging. But are there any of the things that have changed as a consequence of this that you think you'd like to keep and to see continuing after lockdown ends and we can go back to some semblance of normality?
I've been thinking about four things. One thing is about a better work-life balance. I think in children's services, when a lot of public sector organisations, we've talked about agile working for many times. I think the kind of shot gear change that lockdown brought about has given us confidence that we can do it if we're not all in the office together. There are some things that are better where you need to touch base and physically see people. Certainly visits, you need to be out there, and certainly dealing with very complex child protection work, it's helpful to be able to touch base with colleagues, but that you can do some of that virtually. So some people are reporting greater well-being, being able to work from home as well as work physically in an office. I think alongside that is more creative use of technology. There are things that children are saying and families are saying are working better by doing it virtually. But I think it's not an all or nothing. So when we did some work recently with our Cared for Children and asked them what it was like for them during lockdown and COVID-19, they talked about a lot of benefits and they liked Skype, but they said if it's really difficult news, come and talk to us. And of course, that is really important. Team unity and emotional well-being. Some people have been saying we've never felt more connected than we have through this process, and I guess there's something about a bit of an adrenaline rush and all pulling together in a crisis, because it really clearly felt like a big crisis, but that's endured, and we're 12 weeks in, and there's that sense of we know a lot more about each other. We understand each other more as professionals, but as people. And that more rounded understanding of each other has brought about, by and large, a greater emotional well-being. So there have been challenges, but that greater team unity and connectedness with the organisation. And I think, again, that the increased levels of verbal communication and a reduction in emailing. And I guess there's a balance again to be struck, because we were just talking the other day about increased use of different social media. You still need to make sure you're keeping some record of interactions. So some of it'll be out there, and we need to. It's like developing it as we go along. So it's how you strike a better balance as we move forward between emailing and verbal communication. But if we're really intent on relational practice being our model and what guides you through uncertain times, and it being the way of operating and practicing, particularly in social work, but more broadly across different professions, then a higher level of communication has to be pretty key to how we operate.
Thank you, Julia. I think that's a wonderful note to end on. Thank you ever so much for joining us today, and thank you to you and all of your colleagues for all of the work that you're doing in this difficult time.
Thank you very much.
Thank you for listening to this COVID-19 special edition of the What Works for Children's Social Care podcast. We hope you found it interesting and useful. If there are any topics you would like us to cover, or you would like to get involved and share how you are adapting to these challenges, please get in touch. Details are in the show notes. Don't forget to check out our regular podcast for the latest on evidence-based practice to improve outcomes for children, young people and families. You can also find lots of interesting research on our website, as well as other ways to get involved. Thank you.